Hello, I'm Mike Bromirski, Hempfield School District Superintendent. Thanks for joining us today for this extended 2-minute talk. On Tuesday, December 1st, during the school board meeting, I provided our school community with a COVID update. So I'm bringing you this extended 2-minute talk to share some of those highlights. So let's get started. During the school board meeting, the following topics were discussed. We're going to walk you through a couple of the highlights from the presentation, but the entire presentation is located on our district website. We spent a little time talking about the recent travel order that was issued by the Secretary of Health. After that travel order was issued, an FAQ was produced. The travel order does apply to any traveler in Pennsylvania over the age of 11. There are several individuals who this travel order will not apply to, and you see those on the screen. But it is important to note that anyone who is over the age of 11 and traveling out of the state of Pennsylvania for more than 24 hours does need to quarantine for 14 days or produce a COVID test, a negative test, in order to return to schools. With regards to Hempfield employees, we are requiring that any employee who travels out of the state to contact our Human Resources Department prior to leaving the state, and we are requiring those individuals to get a COVID test and submit those results to HR. We're doing this because we want our employees to be back at work to make sure that we can continue providing instruction to our students. November 23rd, there was a press conference with Governor Wolf and Secretary Levine. There were new mitigation orders and advisories issued, and those advisories and orders do have an impact on schools, which is why we did the update at the school board meeting. We're hoping that all parents or guardians take some time to review the information, but we were required as a school district to submit an attestation form by 5 p.m. on Monday, November 30th, to indicate whether we were continuing in full remote instruction or if we were going to be providing the option of in-person instruction that we needed to attest that we'd be in full compliance with Department of Health orders and guidance. If we did not sign the attestation form, we would be forced to go full virtual and we would not be able to provide extracurriculars. We as a district did sign the form and it was submitted to the Department of Education before 5 p.m. on Monday, November 30th. And we do have documentation that our form was received. With regards to the facial covering order, we have been and will continue to be in full compliance, but the part of the attestation form was that we would be in full compliance with the facial covering order. So whether you are indoors or outdoors, facial coverings need to be worn. There are a few exceptions, such as if you are outdoors and you're able to maintain social distancing of at least 6 feet, that you may certainly remove your facial covering. However, if you are outdoors and you are not able to maintain 6 feet of social distancing, you must wear a facial covering. Indoors, we've been requiring our students and staff to wear facial coverings inside the school, except when students are eating lunch and they are 6 feet apart. Or when you are doing a facial covering break, if you are doing one indoors, it's less than 10 minutes, and individuals are at least 6 feet apart before they remove their facial coverings. If you are going to be attending any type of event, gathering, or group setting, whether it's indoor or outdoor, as a participant, you will need to wear facial coverings, as well as if you're participating in indoor physical activity in a gym, a fitness center, etc., you will need to wear a facial covering. From a school standpoint, if you're waiting in a public area, such as a bus stop for our students, facial coverings will need to be worn. Anytime our food services team members are working or anyone's working to prepare food or packaging food, you must wear facial coverings at all times. And again, we have been and will continue to be in compliance with this order. There are some exceptions for individuals. However, all alternatives to wearing a facial covering, which does include the use of a face shield, need to be exhausted before an individual is fully exempted from this order. Some of the exceptions to the facial covering order, if something creates an unsafe condition in which you're operating equipment or executing a task, if you're wearing a facial covering that would either cause a medical condition or exacerbate in a medical condition, including respiratory issues, impede breathing, mental health condition, etc. Other pieces in terms of if you're getting a temporary service, such as dental service, you may remove your facial covering. In the school setting, that would be if one of our nursing team members needs to do an examination of a student in terms of either their mouth or nose that may be covered by a facial covering. Or if an individual is communicating or seeking to communicate with someone who is hearing impaired or has another disability where the ability to see the mouth is essential for communication. Here at the school district, we do have facial coverings that have a plastic clear barrier over the mouth. So that does allow an individual to wear a facial covering. Also a shield could potentially work there as well. We are required to ensure that individuals within our school setting are wearing the facial coverings. We have to make sure we have adequate signage. And anyone who maybe needs a reasonable accommodation with regards to wearing a facial covering, from an employer standpoint, we would work with those individuals through our human resources department. And from our students, we would work with them with our student services teams in our buildings, connecting with the parent or guardian. And then with regards to the facial covering, there are things we are not permitted to do, and those here are listed on the screen. Again, I've already talked about this, but if you're attending an extracurricular event in one of our venues, you will be required to comply with the 6 foot physical distancing requirements, as well as wearing a facial covering, and unless you're able to meet one of the exemption criteria. There are also new recommendations for schools when an identification of a COVID case is made. As we've shared, anytime we are made aware of a COVID positive case, we do report it to the Department of Health. If we have a significant outbreak, that could require schools to move to remote-based instruction model more quickly. But where we are moving, there are new recommendations, and this is why we felt it was important to ensure that we were educating our parents and guardians. But based on school enrollment sizes, there are new recommendations, whether you're a small building, medium building, or large building. There's a thing called a rolling 14-day period, which will start the moment we are made aware of a COVID positive case. There's still a little uncertainty as to what counts as a case for schools in terms of reporting to the Department of Health. So we are seeking guidance on that. We do understand that someone who is COVID positive, that is a case. However, from a reporting requirement standpoint, that is what we are seeking clarification for. When we talk about our COVID counts, they will reset if we need to switch to a temporary school closure, meaning going from full in-person to full virtual. So as we move forward, a temporary closure for in-person instruction, while there are recommendations that are new based on school enrollment, it is also very clear on the documents that if case investigations, contact tracing, cleaning, and disinfecting can be accomplished in a faster time frame, the length of that closure may be shortened. In addition, we may or may not need to close, but all of these discussions will be had with the individuals in the Department of Health when we call and report a COVID positive case. In terms of our communication of cases, we do believe we will need to adjust this. So more to come on that information. So here's an example of the chart that I was referring to based on school enrollments. This is our small schools, which is less than 500 students, East Petersburg Elementary, Landisville Intermediate Center, and Morristown Elementary. So we are in the substantial levels right now. So you would look at the last row, and then based on the number of cases that we were made aware of, we would follow those recommendations after consultation with the Department of Health. Our medium-sized schools, Centerville Elementary, Centerville Middle School, Farmdale Elementary, Landisville Middle School, Landisville Primary Center, and Mountville Elementary will follow this chart. And our large school, the high school, which is greater than 900 students, we will follow this chart. And so you see there are multiple charts. So each school has the potential to have different starting dates with regards to the 14-day rolling period. Each school has the potential for a temporary closure. That could be at a moment's notice. And when you do that temporary closure, we will reset our COVID counts, and the 14-day rolling period will also reset. And finally, the last message that we shared was just a real urgent plea to our parents and guardians to please make sure that you have a plan in place for childcare if you are unable to be at home and schools are only able to provide virtual instruction. We don't want students to be left home unattended if they are not able to be home by themselves. The decision to close schools and a temporary switch from in-person to virtual could be made with little to no notice. So we really need you to have a plan in place for your children. In terms of our choices, we all recognize that we make choices every day with regards to what we choose to do, who we choose to interact with. But it's important to note that those choices do impact the ability to continue providing in-person instruction. Our choices have the ability to reduce strain on all frontline workers. Our choices have the ability to prevent spread of COVID-19. Our choices have the ability to assure that local medical, educational, and other organizations that we count on are there to help us when we need them. And if we don't need them, when our family, friends, or neighbors need them. So we want to thank everybody for your continued support. And we look forward to continue working with you as we provide our options. And just a reminder to all parents, while we do provide in-person instruction, at any point, if you feel that you would want your child to go to virtual instruction, you may do so at any time. You simply need to notify your building administrator. That switch can be made and you can begin the very next day. And then you would stay virtual through the remainder of the marking period or trimester, depending on the level. Thanks for joining us today. I hope everyone continues to stay safe, stay healthy, and we'll see you next time for another 2-Minute Talk.